Recognize Ms. Barragán for 5 minutes.
Thank you, Mr. Chairman. Thank you, Secretary Becerra, for being here, for all you're doing. When I first walked into the hearing earlier, the chairman was in this opening statement and was talking about the border, and I thought I walked into the wrong congressional hearing. What I heard was expressing a disappointment that the budget request didn't address the influx of illicit drugs like fentanyl, which are coming across our border at a rapid rate. I just want the American people to know that President Biden had a supplemental request that had $850 million that he was asking for to help combat fentanyl from crossing the southern border. Another $100 million for HSI, which is investigations from crossing the southern border regarding fentanyl, and the hiring of more Border Patrol agents for this very reason. So the President of the United States and this administration asked for money, millions of dollars, hundreds of millions of dollars. And it is Republicans who said no to that. So expressing a disappointment about the lack of money in the budget for that is a little rich, considering the President asked for the money and Congress with the Republicans in charge have said no. And with that said, Mr. Secretary, I'm going to move on to my questions I have for you. I want to thank you for all you're doing on health care, all you're doing in the space of women's reproductive rights, and all you're doing on Alzheimer's. And my first question is on Alzheimer's, Mr. Secretary. 85% of initial diagnoses of Alzheimer's are made by clinicians who are usually primary care providers. And half of these providers reported that they do not feel adequately prepared to care for those individuals. That's why I've introduced a bill called the ADAPT Act with my Republican colleague, Representative Carter, which would empower primary care providers to better diagnose Alzheimer's and deliver high-quality, personal-centered care. As the number of people with dementia is set to increase, how will HHS work to support workforce readiness, as well as access to treatments and services?
Congresswoman, thank you for the question and all the work you've done on this issue of dementia. We are continuing to work to try to make sure that as we graduate the next generation of physicians, nurses, that we have them going into the areas that we need them most. And so we are trying to make sure that GME, graduate medical education slots, are going into those spaces. We're trying to make sure that, as you just mentioned, a primary care physician gets training beyond what they currently get in most medical schools. I focused earlier on the issue of behavioral health because too many family care doctors, too many internists are not really trained on behavioral health services, and that means someone going in with a child that has behavioral health challenges has to wait to get to a specialist before they start to get the care. Very similar to the question you're asking with regard to Alzheimer's. We would be very supportive of any initiatives, especially if they come with resources, so we can make sure we can implement that to make sure the healthcare workforce actually addresses the needs of the populations that we're seeing grow.
Great. Thank you, Mr. Secretary. I also want to thank you for a demonstrated commitment in the budget, to cut the cancer death rate by 50% over the next 25 years, which includes implementation of President Biden's Cancer Moonshot initiative. Every 3 minutes, someone in the U.S. is diagnosed with blood cancer. One such cancer is multiple myeloma, where early detection is key to effective treatments. My sister has multiple myeloma. She's only 2 years older than I am. Of course, our colleague, Republican Steve Scalise, has been battling multiple myeloma. And so I know firsthand, what he's going through with the stem cell transplant and ongoing chemomeds people take. Can you share the importance of funds for the Advanced Research Projects Agency to improve early detection of such cancers?
Congresswoman, ARPA-H, the agency you just referenced, unlike the National Institute of Health, when it engages in a research program, it is not the long-term 10, 15-year process that NIH usually goes through to try to get some innovative therapy on the ground. ARPA-H is meant to harness those innovative ideas that are out there in America but haven't yet been catalyzed with resources. And ARPA-H says, if you can get something going in the next 2 or 3 years, then you're in ARPA-H's space. And so something like the issue of cancer, if there's an innovative idea on how to address any number of cancers. ARPA-H is a great platform, so long as that proposal can get out there within 2 or 3 years.
Well, thank you. I'm interested in working with the agency on the moonshot initiative, especially on blood cancers, because there is no formal program at the Centers for Disease Control and Prevention, so hopefully we can get that on a bipartisan basis done. And with that, thank you, Mr. Secretary. I yield back.
Generally yields back. Recognize Mr. Pence, 5 minutes.
Thank you, Mr. Chairman. Thank you, Ms. Secretary.